Okay, and welcome to another edition of This Week in Hearing, a show where we discuss all types of news and innovation that's happening, broadly speaking, in the world of audio, more specifically for this episode, in the world of hearing health. And with me today, I'm joined by Kat Penno and Andy Bellavia, two of my good hearables and hearing aid pals. So good to have you two back. Why don't we go one by one, let you introduce yourself? We'll start with you, Kat.
Hey, I love that. The three amigos back together again. I'm Kat Penno and I'm the current Director of Hearing Health with Nuheara. Prior to working with Nuheara, I ran my own telehealth business called Hearing Collective, where I specialised in telehealth consultations and digital apps and digital health. That was one part of it, and the other part was consulting as well. I've got a really big bee in my bonnet about the adoption rate of hearing aids in general, the uptake of hearing health in the world. I'd like to see our clients and consumers reducing that age from 72 years of age of hearing aid adoption right down to the 30 to 40-year-olds where we start to use hearing tech. We're a bit more proactive about our healthcare and then transition across as we need through the lifespan. So that's what my ultimate goal is with my professional career. Thanks for having me on.
Absolutely. It's great to have you on. And of course, Mr. Andy Bellavia.
I love that three amigos, and it's great. I appreciate you inviting me again, Dave, to be on with Kat. It's always a pleasure. I really like beating it around with you guys. I'm Director of Market Development for Knowles, and we're a component supplier to the hearing health and other industries. I'm responsible for all the in-ear products which are not prescription hearing aids. So I've been involved in the hearable side of things from the beginning. I mean, going back to Bragi and Doppler and so on. And it was really, I've appreciated from the beginning the innovation that Knowles always was involved in to advance hearing science and hearing aid technology. And of course, about 5 years after I started working for Knowles, I became a customer myself wearing those. And so I've seen it both from, the industry side and also from the patient side. And still, very much have always been an advocate for hearing care and hearing innovation and accessibility, everything that can move the needle on the low adoption rates in hearing care today.
Yeah, well, thank you so much for being on, Andy. We were actually complimenting you before we started recording with your beautiful Christmas tree in the background. We found out that's actually a picture. That's what Andy's bottom half of his house looks like. That's that room down there. It's beautiful. And then Kat mentioned that it's also 40 degrees where she's living in her part of the world, but that's actually 40 degrees Celsius. So she is her Christmas setup's a little bit a little bit more tropical than Andy and I's. But
a lot more tropical.
Yeah. But regardless, for those watching, the three of us have known each other for years now, and it's always a lot of fun. We usually do this on my podcast, bringing it over here to This Week in Hearing this time around to do one of these. We usually do them like once or twice a year to just kind of talk through some of the major things that are happening. And as we head into a new year, it seems fitting to all hop on and talk through it. And so, for today's conversation, we kind of bucketed the talking points into three big buckets, and we'll kind of go through all three and throughout this conversation. But ultimately, it's the ways in which the patient journey and the consumer expectations are changing. It's the seemingly incessantly increasing advancements of the technology and all of the really, really exciting things that are being yielded by this technology and the breakthroughs happening. And then the third would be, kind of the evolution of the hearing healthcare service delivery model. There's a lot of things happening at the macro level and then also sort of more in the micro level that are, I think, going to really shape the way in which care is facilitated in 2022 and beyond. So the way we thought that we would kick this off is, as we speak through that consumer, changing expectations and the evolution of the patient journey, Andy, I thought you would be a really great person to talk to as somebody that, as you just mentioned, you do wear hearing aids now. I think you fit into that, I don't know if it was a full 7 to 10 year gap, but you were hesitant for a period of time. And then So I'd be curious to hear about sort of that process of getting to the point to where you decided ultimately to get fit with hearing aids, the process of being fit and what life's like now. And then ultimately, if you were Andy, just call it 5 years ago, but in 2022, what would those expectations be like now? How would you want to approach this whole new facet of your life, sort of in light of how things have changed in the span of time that you've really been following this space?
Yeah, a lot of things have happened all at the same time. My own personal journey, and also the technology, hearing tech, and also hearing delivery models have all more or less changed together. I've been wearing for 3 years now, and I waited the required 7 years before getting fit. And, really, I could say when I think back about it, and I've reflected on it a lot because it's part of the discussions I have with other people, is that it wasn't active resistance in my case. It's that it was so gradual, just little by little, especially in social settings, where I had a harder and harder time hearing people further down the table. And eventually it got to the point where I could only talk to the people around me in a loud pub or restaurant, and, other situations like that. It got to the point where if my spouse was talking to me when I had my back turned to her, I had a hard time understanding her, So it happens so slowly and gradually that you get yourself lulled. You don't realize where you were and, where you're at now, because it happens so quickly or so slowly. And also, I knew what the journey was like, busy at work, busy with other activities, some volunteer things I do and whatnot. I knew that it was, a visit to the doctor, the ENT, and then multiple engagements with an audiologist. Like, when am I going to find time to do all this? I'm okay. It's fine. And that's how you talk yourself down that 7-year journey. And what I would tell you, I would have said this 3 months after I got fit, is it was the stupidest thing I ever did. Now, mind you, if I started that journey today, I would probably be in a self-fitting device when I was milder and then worked my way into it. Whereas at the time, even 3 years ago, there was barely a device, that would have done. Well, 3 years ago, I was already getting severe enough that it wouldn't have worked. And 5 or 6 years ago, the sort of devices available today to get my feet wet in hearing care didn't exist. And that's really what's different now. And what's so exciting now is that both in the delivery model and in the devices, there are a lot of accessible solutions for different people at different places in their journey. And that's the exciting part about where we're at today.
Andy, I always love hearing your reflections, because I think they're so important to hear out in our industry for the professionals and our customers or the clients, or everybody who's in your boat. Could you tell me a little bit more about your feelings at the time, if you reflect? Yes, you're busy in your day-to-day life, but when you miss parts of conversations, or your wife started to yell at you, if she did, I'm just wondering, how did you really feel about what was your emotional response to the missed pieces of the conversation?
Well, I didn't really get a lot, like some people get a hard time from family members, and I didn't really get that. My spouse talked to me about it, and I knew she was right. I'm a social person, and the thing that really got me was how I was becoming increasingly unable to participate in social situations. That was the hardest thing. And I was traveling, until the pandemic, I was traveling all over the world and meeting people everywhere, or going out with friends when I was back home. And that was just getting harder and harder to do. And that's so much of who I was. I finally just said to myself, really? Are you going to sacrifice all that just because you won't carve out a few hours to get your hearing taken care of? It really bordered on the ridiculous by the time I finally got off my chair and went and did it. And that was really a shame. And I think it's a shame for whatever reason other people are compelled to wait like I did.
Oh, Andy, that's, to me, it honestly blows my mind often. And I asked you about your emotional response because I think a large part of where hearing healthcare is shifting is into this space of psychological ownership. And in order for us to deliver truly self-fit, self-managed, proactive hearing healthcare, I think we have to understand the nuances of each individual who comes in and how that can be empowering to them when they go out and have to use these new small tricky devices that go into their ears. I think we have to improve the user experience and the situation in the real world as much as we can without having this very heavy clinician-led or physician-led model, which is what I think hearing healthcare was maybe, say, 30 years ago, 20 years ago. And up until the last couple of years, we've all been anticipating the release of the OTC Act and learning more about the details of that, which I might get Andy or Dave yourself to talk to a bit more, because I guess my view is a bit tainted being in Australia. But I'm all for the Act. I'm really excited to hear how it rolls out. I've been listening to a lot of Cliff Olson's breakdown of it, which I thought was excellent, and read Carl Strom's write-up about it. I myself didn't go through the 114 pages that were released, so it was good to hear about these other experts and their point of view on it, because I think it will severely influence this mild, moderate hearing loss category. And even here at Nuheara, we see that those beyond this category, we're going to talk in categories, we have a lot of consumers coming to us who don't fit the model in terms of the gains we can give them and their hearing loss severity and their needs. So to me, it's really telling what the consumer wants and how they behave and want to behave versus what's out there in the world. So I think it'd be really great if we look at, like Dave was saying, the channels, the service and the technology, proactive healthcare to reactive healthcare to proactive healthcare.
Well, I'll just add to this opening part of the conversation that I think I'm a poster child for how hard it's going to get people to come to the realization that they need to address their hearing loss. And the thing about OTC is it's a more accessible solution for people who are mild to mid, but they still have to step up and say, I need to address my hearing. And I'm a distance runner, and so distance runners are all very self-aware, and the same would be true of people who bike, right? You're very aware about what your body's doing and what it's telling you. And as I've gotten older, I've just naturally made accommodations for where I'm at physically at that point, because, an older runner is not the same as a younger runner, and you have to do things differently. You have to adjust and adapt. And I would do that quite seamlessly. I don't have any issues being where I'm at in my running, even though I can't turn out the times I did 10 and 20 years ago. All good, right? And yet hearing, I did not approach it the same way. I waited and I let it get worse and worse. I would never do that in running. If I need to get a different shoe because I'm older now, I just went and got a different shoe, right? But in hearing, no. And I look at it this way. If a person like me rides down, that slide to the bottom before they address their hearing loss, it's going to be hard to get people to think about their hearing differently. That's actually, I think, the biggest challenge. It's not only about the price of the device. There's certainly an accessibility issue, because one of the reasons why I didn't do it was because, there's a lot of friction in the journey. And if you live in a place where audiologist is far away, like you live rural, for example, it's even worse. But ultimately, people have to realize and admit to themselves that it's time to address their hearing. I think that's the hardest thing. And that's the thing we're going to have to work on the most in all this. OTC is fantastic. I think it's going to drive accessible solutions globally, even though it's a U.S. initiative. And I mean, we really should talk about that, because I think that is one of the keys of greater adoption rates of hearing care and hearing solutions. But I think ultimately getting people to be self-aware about their hearing and then address it is the single hardest thing.
You hit the nail on the head, Andy. I love this. I just jotted it down because I was like, that is a gold nugget. Thinking about hearing differently. That's exactly what needs to happen at a global scale, and everybody has a part to play in that. Oh yeah, I agree. Let's talk a little bit more about the OTC Act, and then I also really have a hankering to talk about other tech and how that would apply to hearing health and the consumer journey and that long-term behaviour change. So over to you, my American comrades.
Well, Andy, you said a really interesting term there too, which is friction, right? And I think that that's so key. I think that reducing friction is something that we as like an industry can control, is making it easier. But to your point, I fully agree with you that until the consumer or the patient actually takes it upon themselves to want to take action, I'm not sure how much of a different form factor or a lower price point or even a more accessible solution is going to matter when people might be coming at it from a similar angle to you. And I think that the devil really is in the details with, to your point, one of the biggest problems is it is usually this gradual decline. And I think that presents a problem because of the gradual nature of it, it's a very slow erosion. And so it might take you years to really fully lose certain frequencies. So you just slowly start to kind of forget that you're not really hearing the birds chirping anymore. And it's not something that just happened overnight where you're kind of like shaken by it. It's that gradualness that I think is part of the real problem here. And so that's why I keep coming back to, one of the most effective ways that you can combat this is basically what's happening right now with the consumer side, the real consumer side. I mean, I'm talking the skull candy $100 headphone consumer side that's getting this technology baked into it, unbeknownst to the consumer. And I think that, it's basically like you have a portion of people that are going to buy these devices with these new ubiquitous features. You see all kinds of really exciting partnerships from this sort of like at the operating system level, whether it's like with what Mimi's doing, and you take even a step back from that, and you look at kind of like what Braggie's ultimately trying to do with the OS piece of being the OS of the, of all these different hearable devices. And you bake in that layer of functionality into it so that when you unbox those $100 headphones for the first time, you're actually seeing that, oh, there's this like new feature that's included in here that might just take turning it on. And I think that could be really powerful for a lot of people, because again, going back to this gradual effect, you have this like slow erosion of different frequencies, and then suddenly you restore them almost unintentionally, but then you get a taste of like, oh, wait, that's what I've been missing out on. And then for me, it's like, again, in the absence of people really having this initiative to, at scale, want to combat this, you almost have to just have a ubiquitous type solution that solves it, across the board for those that are ready to have that conversation. And so I think that's one of the most positive things that's happening right now with regard to that, is that it's that rising tide lifts all boats. It's, this idea that there really is kind of like a standardization that's taking place right now of these hearing healthcare oriented features. And I think that's going to be a gigantic net positive, because I think you're going to just create a massive amount of exposure.
Yeah, I agree. Hearable Tech is really a Trojan horse for introducing hearing related issues to the consumer. Just exactly what you said. The first time you buy, you'll be able to buy skull candy with Mimi embedded. And the first time somebody buys a skull candy and, they go through the setup and wow, this music sounds great, or look what Apple is doing. Now, if you use AirPods and an iPhone, and it'll actually alert you that you've been listening so long that it's going to reduce the volume level. And of course, you've got nascent hearing functions being built in AirPods Pro. And once you have those things rolling, people start to absorb it in a natural way. And just wait, like my dream is that one day Apple does one of those funky and cool AirPods commercial, except it's a person walking into a crowded pub and it's all just babble, and he just goes like this and the babble goes away and they talk with some friends, and and all of a sudden hearing is going to be very, very cool. And I think that's exactly what's going to happen. Not even official OTC devices, but just hearing devices. Or hearable devices that have hearing related features in it are going to introduce people to hearing care and hearing issues in a very non-threatening, very positive reinforcing way, and that's going to start to change the game altogether.
100%, I agree. This will be the new standard in any hearing tech that you purchase. If there is not an option to personalise and then augment your hearing experience to some extent, then you're probably not living in the 21st century of where these smart devices can take you. And it's similar to homes, right? There are smart devices in your house now. Your air conditioner can be hooked up to your Wi-Fi. Your Thermomix can also be hooked up to your Wi-Fi. You can do a whole bunch of things with all the tech you've got in your house. I think everything that we wear on our bodies will certainly get to that extent. And that excites me so much that, you know, brands like Skull Candy and Mimi are having these partnerships, because it's exactly what we need to slowly nudge these little bits of golden nuggets that us as healthcare professionals and those in the industry know about, and we get so frustrated that we don't see anything changing largely from the consumer at scale. So I think that's exactly what needs to happen en masse, if you like. And I'm totally pumped about what's going to happen in this space with all the tech that's coming in. I think when I think about other technologies and how it's happening for the consumer, and when I think of the consumer in this space, I'm thinking teenagers. They'll start their journey with, like you said, these affordable headpieces, watches, rings, whatever it is. And then they'll just be so accustomed to these apps and looking at this data and understanding how they work and what their normal looks like. And then how do we fit into that role? And then what does that look like in the years to come? And I've been thinking about it loads more as the years change and the factors that influence how industry changes. And I still believe that the service component of healthcare professionals is extremely important. And I think what's currently happening now in this space is still going to be the status quo, which I don't think is necessarily a bad thing. I think those who require face-to-face, on-hand, clinician-led support, they will always be there. And then we'll have this new opportunity and these new markets and these new behaviours opening up, and then that clinician will also look quite different. So I go back to conversations we had before, where I think what I envision is clients will come to us with this data from devices that are almost agnostic. So someone might come to me in the future with Skull Candy devices and these Mimi hearing tests and say, hey, I think this is happening, can you help me? And this might be someone in their 30s who's a young professional, and then we'll talk about what solutions are available to them as they progress their careers. They tell me their goals. I say, cool, you control all these tech, this app, out in the real world, come back and let's work together. Or I can support you via asynchronous messages. The world is our oyster, and I'm really excited to have these consumer electronic brands come into the space and impart these little bits of education or knowledge translate quick and nudge this consumer along earlier.
I love that you mentioned that. This is one of my favorite things to talk about you with, is the idea of like these data health coaches, or health data coaches. And I think that you and I really see eye to eye here, where I think that the hearing professional, like if we're really thinking about what role do they play today, the vast majority of those patient interactions are they're typically one of three things, really. I mean, it's pediatrics in newborn testing and infant hearing screening, and then it's dealing with older adults and age-related hearing loss, and then it's also all of the different conditions that happen across the age spectrum, but usually skew more toward, the higher severity levels of hearing care. And so it's very medical in that sense, where it's usually catering to those that need the help the most. However, I think that because of how much it skews toward those higher ends of severity, I think that we've sort of just kind of neglected the rest of the market in that sense, and in terms of like a hearing care professional actually having some sort of relationship with a 30 something that might actually not have any hearing loss. And I think that this is what's really exciting, is that, as you look at the way that the wearables, like broadly speaking, are maturing, they've gone from being like, if you really look at the wrist as being the precursor to what's probably going to happen with all of these different body worn computers, the natural progression has been that, basically they were searching for a use case and they kind of landed on it over the last like 2 to 3 years, which is largely around like taking the fitness data and then either going and using it in a medical setting, or like going even more granular in the fitness data to become to start to garner and glean actionable insights. Like this whole portion around insights, actionable things that you can decipher from the data, is like wearables 2.0. And so I always now think about like, what is that going to look like when we're talking about in the ear devices that you're wearing by and large all day? If it's like a hearing aid, or even if it's AirPods, you have a giant portion of the population wearing these things for extended periods of time. So the first question is like, what kind of data can be captured from that? And it's not just biometric data. Like, yes, there will be heart rate sensors and there will be all kinds of different PPG sensors that can capture the biometric side of things. But you look at like what Starkey's doing with Livio, that's really interesting. They take all the acoustic data to be able to tell a story and see, are you getting out of the house? Are you challenging yourself from a, basically like a cognition standpoint? So you have that, you have everything that's coming with, you look at these big giant behavioral companies like Noom and everything that they're trying to do around weight loss behavior, and encouraging healthier lifestyles, smoking cessation, all these different things. And then also you look at like what's going on with Headspace and Calm and this mental health piece, right? And so again, the ear is super interesting in this regard because it's actually serving two really distinct roles. One is it's the ability to be a data capture center. And then the second is that it's like the interface in which you're having you're basically experiencing the audio internet. And so these two things combined, I think, really lend themselves to this idea where you could have, whether it be the hearing care professional is like taking a portion of the data that's being captured and helping to make sense of that. Again, going back to this like Livio piece where you're looking at the cognition data and you're seeing you might be, first of all, you're not utilizing your hearing aids much at all because you're not interacting with others. And then second, like, are there troubling signs from a cognition standpoint? So that's one very specific example. But when we start to look at the future of this, I really agree with you that much of the role of the professional, again, when we're looking at the broader scope of things, very much might be around this. I'm an expert of all things ear. So I'm going to fit you with this thing, but also I'm going to help to make sense of some of this data that like I'm an expert in really deciphering through as well. And all of that just makes me really excited because you realize like there's a gigantic role for somebody to play this role.
I just had this image as you were talking, Dave, and it was really like this big culmination of everything you were saying to the point where these larger external factors like audio content and the ears being the gateway to your experience of this audio content and enjoying it or not. And made me really think, or envision that it will be the standard that everyone does a basic air conduction screening with their device to experience a better meditation, a better Noom experience, a better whatever it is to get you there. And then when things start to deteriorate, there might be that pop-up message that says, hey, you really got to do something about this. And you do, because the understanding of how you're hearing or experience the content and the world around you has been, it's starting to track. And I just had this vision of everything coming together, and the role as the professional will be a healthcare coach with the ability to use a longitudinal data set and understand. And I love that Starkey's got the ability to look at so many health factors in their devices, because it totally makes sense to me. That a lot of the conferences in the audiology world now are focused on cognition. How can the audiologists be doing hearing tests, diagnostic hearing tests, and maybe a basic screening, a really red flagging to the GP or the referrer, hey, we need to do something about this because we know social isolation, depression, loneliness is a large healthcare concern or issue in the world. So are we the best people placed to do something about that? Yeah, I think so. Andy?
Yeah, I think you're exactly right. And, despite all of the tech that's coming out, I think there's always going to be a place for the hearing care professional. It's actually going to expand. And one of the most intriguing areas, I think, is what you two just talked about. When you look at the link between hearing loss and cognitive decline, you look at the ability not only to help correct for hearing loss, but also to measure cognitive functioning in a hearing device. You really have a powerful tool for helping people age well, because you now have in the, coalescing on the hearing professional cognitive data, hearing data, and a person who has the expertise to address both, or certainly to red flag it. If you have a medical cognitive decline issue, that's the person who's going to pick it up first, both from the way they interact, maybe assessments they do in person or online, but also the data coming from the hearing device, while at the same time, at least theoretically, reducing the rate of cognitive decline by addressing hearing loss. It's a very exciting area. And one facet, I think, of where hearing care is going in the future, because traditional hearing care is about putting a hearing aid in a person's ears and they can hear somebody's voice better without addressing a person's entire lifestyle. So, tomorrow's, even today's, some hearing care professionals, but not nearly enough of them, will address the total lifestyle. Will ask their client, do you like listening to music? Oh, I love listening to music. Well, I can give you good quality music with this device over here because a hearing aid isn't it. What do you do throughout your day? Well, I work, I'm a professional, I have a lot of Zoom calls. Well, let me tell you how to get the best audio experience during a Zoom call, right? So all of those things, the relationship between health, cognition, and hearing, and lifestyle, they're all going to coalesce, and the hearing care professional has a place there, probably the best place there, whether served remotely or in person. I think that is the hearing care professional of the future.
Yeah, I have a bunch of thoughts here to tack on to both of what you said. I agree with you. First and foremost, I think that I've had so many of these conversations lately on my podcast and on here where it's like this idea of what's going to be the role of the provider in the future. The role of the provider is totally going to expand so long as like each individual provider takes it upon themselves to do so. I've had so many encouraging conversations about new, we were talking just before we started recording. We were, because Kat's down in Australia, and I asked if she ever runs into Angela Alexander down there, which she does not. She's on the opposite end of the country. But so Angela's leading the charge around APD, auditory processing disorder. That's a huge swath of field that you can go into. And there's lots of different examples like that. So I have absolutely no doubt in my mind. But again, I think it goes back to this idea of Kat, you said something there where it's you're going to have these baseline tests that are issued through these applications. And don't forget, all of the hardware that's coming out will have these capabilities baked into them. So you can have, when you go into Noom or you go into, your podcasting app or whatever, I think it's very feasible to think that in matter of 1 to 2 years, as this becomes more pervasive, you'll actually see a lot of the applications driving this as well, where they'll say, we want to make sure that you get the best sound quality from Spotify. And so we want to, basically measure your hearing and match you to your profile or something like that. And this is where I will give Nuheara a lot of props, because they saw this early on, which is, and to your point, Andy, it's these complete lifestyle changes. As we become more connected and in these more digital virtual settings, having your fingerprint of your ear, your ear print, and having that custom profile be able to be configured for all the digital sound that comes out in your life, I think is highly, highly important too. So we're at this really early onset, I think, of, you historically had these devices, and the role of the provider was very much to make sure that device was optimal for your ambient physical acoustic environment. Now, like as a second iteration, you want to make sure that their internet experience is very similar. And I think that we're going to just see there be more and more examples where it's like, wouldn't it be nice if I had my hearing profile for my Netflix on my TV or the Zoom call that I'm having right now? And I think like as a hearing care provider, you're probably the most uniquely suited to make that like scenario real for a lot of these people. And there's a lot of value already today. And I think it's plausible that it's just going to extend to more and more use cases of like, this is your individual sound ID for the world.
And I think that attitude is actually essential. To a certain extent, I think of myself as a canary in a coal mine. I mean, not exclusively, but I think I'm on the front end of people who grew up connected. And people, in my cohort or following are going to demand that they have devices that serve their entire connected lifestyle. I mean, I listen to podcasts, and it's a joy to listen to podcasts with corrected audio. But in the pandemic, and realistically afterwards, there are going to be a lot of people who spend more time talking to others on the computer than they do in person. And if you don't address that part of a person's lifestyle, then you're really leaving them out. I mean, everybody talks about Zoom fatigue, and I am 100% amazed. I'm streaming this audio through my hearing aids right now, through the TV connector, the low latency TV connector. And it's fantastic. I mean, I can do this all day and be relaxed about it because I'm not going into cognitive overload trying to understand people out of the speakers of my notebook computer playing into the hearing aid microphones rather than direct streaming in. All of these kinds of issues are going to need to be addressed for connected people later on. They're going to reject a hearing aid if they don't get good music quality. Well, hearing aids today, they're getting there, but the way you address that issue is you set somebody up with an alternative device, like say the Audira headphones for their music listening, right? And so, okay, fine, when you're out and about, wear your hearing aids. When you want to listen to high quality music, put these headphones on, right? Getting people to the best hearing situation in all the different parts of their life is going to be essential going forward because everybody following me is going to demand those things.